At 6 p.m., we're taking you deeper into the impact of the coronavirus.
And tonight we are joined by Dr. Ali Hassoun, an infectious disease specialist from Huntsville Hospital. Thank you so much for being with us this evening.
Oh, thank you.
Dr. Hassoun, how concerned are you about hot spots and those clusters of outbreaks here in North Alabama?
I can tell you it is not surprising, and that's what we predicted from the beginning. There is chances we're going to see these clusters because we know the coronavirus did not go away completely. And as we start reopening, there is a higher chance of exposure, which means higher chance of transmission, which means increase in the number of cases. So it is not surprising, but it's worrisome because the more cases you're going to see, the more chances of a sicker ones, the more chances of death, unfortunately.
CEO at Huntsville Hospital, David Spiller, said at a news conference recently that a spike in positive test results at the flu and fever clinic could be a result of this partial reopening. And it wasn't unexpected, you say. Did we open too soon, in your opinion?
And you know, we always say that the whole long way is, I think it was reopened sooner than it was supposed to be. But we need now, it's a reality. We need to get the people and the community work with us, being on the guard in the way of keep physical distancing, the hand hygiene, pay attention to exposure, avoid gathering big ones. All these is going to help us out. It's really concerning, and we've been seeing some of that. And I can tell you in the next few weeks it will be more clearer how this is going to go as well.
What's in development at Huntsville Hospital? Are you involved in any trials for drugs with any other agencies or universities?
So we actually had now availability of different medications, and we've tried different forms like hydroxychloroquine in combination with other medication. We've tried what we call an IL-6 inhibitor. We actually recently had an accepted manuscript to publish about experience with that. In addition, you know, with the news of remdesivir now, arrived in Alabama, we had our first limited number of shipments of remdesivir, but it's all these is hopefully we're going to have some availability. But again, I think the most important part at the moment is a prevention, because all these treatment hasn't proven 100% it's going to be effective. Prevention is known to be effective.
We're going to talk more about remdesivir in just a minute, but I want to get back to this hydroxychloroquine. The National Institutes of Health said today that they're going to begin a study to evaluate the combination of azithromycin and hydroxychloroquine for treatment of coronavirus. You said that Huntsville Hospital has used those drugs, and what were the results?
So, you know, we've used it in several of our patients, and we've seen improvement. But I can tell you, sometimes it's hard to judge these if it's a small numbers. That's why we really need trials to compare those who doesn't take it to make a better judgment if these are effective treatment or not. Because what we have currently in the literature about these combination been very mixed results. It's hard to tell. But in our experience at the moment, we think some of these patients did get better.
New supplies of the drug remdesivir were recently distributed around the country. Huntsville Hospital received some. How does the hospital determine which patients will receive it, and how much of the drug does the hospital have?
So, you know, the distribution is coming from the Alabama Department of Public Health, and they're the one who's going to decide which hospital get how many doses. For us in Huntsville Hospital, we actually already have discussed, especially we got our first shipment yesterday, we've discussed about the protocol of which patient will be most suitable. Especially the Alabama Department of Public Health gives certain criteria, and we added to that other criteria so we can use it to the most needed, basically, because it's limited amount of these doses, so we really need to use it in those who most need it in there.
And what happens when it's all gone?
And that's one of the concern, but I can tell you we've had some success in some other ones that we've used. All these medication, including remdesivir, hasn't been proven 100% effective. So we're trying our best to use what is most suitable, what's most appropriate in each one of these patients, because each one of these patients can have different needs for different medication and different management options sometimes.
In terms of a vaccine, how will the vaccine work?
The vaccine is basically you expose the patient to what we call a killed virus or part of the virus, and by that you hope our immunity will rebound in a way that make fighting possibility toward the virus. So you give the vaccine, you make up that immunity in a way, so if we get exposed to the virus at any one point, we might be able to fight it off.
When do you think a vaccine possibly would be available to the public? And I've heard that we've actually never created a vaccine to fight against a coronavirus in the past.
And that's true. So there haven't been any vaccine made before all the COVID issue comes up. But since the COVID issue came up, there is hundreds of different trials are trying to look at different type of vaccines, whether in the United States or overseas. Unfortunately, this is going to take time because you want to make sure when you give anything, medication or a vaccine, it's going to be safe. So safety is first, and then is it efficacious? Efficacious, to know it, it's going to take several months to study and know. So it's probably the soonest is going to be sometime in the fall, but that's really, really optimistic way of feeling about it. It's probably going to be much longer than that.
And Dr. Hassoun, what if the vaccine doesn't work?
Yeah, so this is an excellent question because, you know, in our population who get flu vaccine that we encourage every year, it's not 100% effective. Even if it's 50% effective, it's good in a way because some of the other ones who get the vaccine, even though it's not effective, but it might give some immunity. And by doing so, it might help fight it in a way because you can get some sort of like immunity, the whole community, so you can reduce the severity of infection, like what we have the flu, hopefully. So it does help, even if it's not 100% effective.
Great information as always. Dr. Ali Hassoun with Huntsville Hospital. We appreciate you being with us tonight.
Thank you so much.